Hello, everyone. Welcome to School After Hours podcast, where staff, administrators, and families keep their finger on the pulse of the wonderful world of OST programming, aka out of school time programming. I am your host, Jay Lee, and on today's show, we have Miss Yolanda Hall with us. She is a returning guest. Miss Yolanda did our mindfulness episode and how to use it to deal with trauma. So for those of you that are interested, I'll go ahead and put that link of the show in the show notes and you all could take a listen. And for those of you that have already heard it because you are such dedicated listeners, you can go ahead and do a recap for me. So on this episode, we'll be talking about mental health. Yes, y'all, mental health and why it's important in youth development for staff as well as for children. But also, we'll go ahead and talk about some tips that organizations can use to incorporate mental health practices to avoid burnout for staff members. So that's really, really important, especially with everything that's going on now. With that being said, let's go ahead and jump into our Community Corner. Community Corner is a segment of the show that allows guests and myself to share tips, advice, or information with families, youth, and community members. So for Community Corner, I asked Miss Yolanda for some tips that we could use for practitioners as well as families to exercise mental health. So Miss Yolanda, go ahead and give us those three wonderful points for us.
Yes, absolutely. Well, first of all, again, thanks for having me again. As far as tips for families, we don't spend enough time at the kitchen table together. Okay. So we're going to keep it simple and make sure we plan at least one meal together at the kitchen table. Just having those conversations going throughout the day, just recognizing that communication is more of your body language and those nonverbals. And so, as we sit and we're eating and we're talking, to just pay attention to what's going on with each other and check in, just to see how we're doing, just having those conversations, debrief in the day, getting support from each other and things like that. And it's not an easy thing to do, but it's something that could solve some problems at the table. You know what I'm saying? We could take care of some stuff at the table. So definitely doing that, just keeping it real simple. And then as parents or adults in the household, that we model the importance of mental health, right? And so when we are talking to our spouses or talking to the other adults, that we're using the words mental health, mental wellness, and that we're normalizing it in our spaces so that our kids can see, oh, in my house, this is something that we talk about, right? And so then we don't have to worry about that generational thing going on for generations to come, because if it hasn't been talked about in my house as a kid, at least I recognize the importance. And so my children can take that into their adulthood and with their children. As far as a household, those are some things that I would suggest. And then for anybody, practitioners or at home, like, we talk about mental health, we talk about wellness, let's schedule it, right? Let's put it on the calendar so it happens. We have our doctor's appointments on the calendar. We have our outings. We have all of our business and our work stuff on the calendar. Schedule some time for your mental health, right? And so find a practice that serves you, something that you enjoy, something that provides you peace and calm, whether it's breathing, mindfulness, meditation, exercise, yoga, getting outside in nature, having social events, or tapping into your spirituality. And then I guess the last thing I'll say is that we should have a circle of support. And I know that I shared that with you before. And, a circle of support is awesome because it's an intentional act for you to figure out what and who you need in your life, what roles each of those people serve, and then communicate to them. Listen, I need this in my life, and you're going to serve that purpose for me. So if I need to call or text at 3 o'clock in the morning, I need you to be that person. Got it? Okay, cool. So we're going to do that and let them know that they serve that role in your life. And then when you reach out to people, be very clear on whether you need empathy or you need a solution. Sometimes I just need someone to listen. Don't try to solve my problems. I just need you to listen. Or I need help solving this problem. And so I'm gonna be quiet so you can help me with the answer, right? So just making sure you have that circle of support. And whoever that is different for the individual. I may need different people in my life than you. So recognizing and being intentional about creating that circle of support.
I know that's right. Go ahead and drop the mic. Go ahead and drop the mic. That's it.
Yes.
We done. We done.
Yes, yes, yes. And you know what? If I could add one more, I
Sure,
always
sure,
got
sure. Go
something in the
ahead.
toolkit.
Yeah.
So, what about scheduling those annual mental health checkups? So, we schedule our annual um, health exam, our physical exam. So, let's schedule our mental health exams as well once a year, whether it be counseling, therapy, coaching, or someone at your church, someone really close to you, but carving out some time once a year to put some serious emphasis on your mental health and just check in and make that a regular practice, I think is helpful and very impactful.
Thank you, Miss Yolanda, for sharing that great information with us. Now, let's go ahead and jump into the show. Yes. All right. So, Miss Yolanda, we're going to roll into these questions.
Okay.
So, for those that did not catch your episode before, and I'll go ahead and link it in the bio in the show notes so they could catch up. For the people that are new and do not know you yet, go
Hmm.
ahead and tell them a little bit about yourself and how you got into mental health.
Yes, well, I am originally from New York. Janice is my New York homegirl. Grew up in
Boop, boop,
Queens, New
boop.
York. Yes. Came to Virginia for college and earned my bachelor's of science in psychology. And that was kind of a fallback. So we won't get into all of that. But, everything happens for a reason. And as I was trying to figure out what's next, I decided to pursue my master's of education in guidance and school counseling. And so I was a school counselor for 15 years, did 13 of those years in middle school and 2 of those years in high school. And I saw a lot of myself in those young people, right? And I realized as a school counselor, I was very limited in my ability to help and serve the young people and definitely to help and serve the families as well, because the ratio is supposed to be one counselor to 250 students. Try one counselor to 380 or one counselor to 400. I've had those numbers. And how can you really be effective with those type kinds of numbers? And so 4 years ago in July, I got an offer to go work for Henrico Mental Health, which is the local community services board here, but it was in the prevention department. And so I was like, ooh, prevention, you mean I can help somebody get ahead of this thing?
Right, right.
Okay, right? Work with young people and start having these conversations about mental health and wellness at an early age and just helping them again recognize their self-worth and what they need to do to be well. And so a lot of evidence-based programs that we do, we talk about all areas of prevention. So alcohol, tobacco, opioid, suicide prevention, violence prevention, all those types of things. And so I'm really loving that position. And so but when I came, I was excited about mental health. And then when I got into the field, I realized the stigma is real, real. Right. As soon as you start bringing these conversations up and then wanting to have them with the parents and the families, people start to draw back. Wait a minute, you're getting too
Mm-hmm.
close.
Mm-hmm.
You know
Mm-hmm.
what I mean? And so then I recognize really how necessary this work is. And so one of my superpowers is establishing relationships with my students, with the families, with community stakeholders. And so I just realized why it was so important for me to be here. And then moving forward a year ago, a little over a year ago, I decided that with all these limitations of me trying to help young people and families, I could do it better and
On
be
my
a little bit
own.
more effective on my own, right? And so I became a youth life coach or a youth mindset coach, right? Because at the end of the day, it's all about the mindset and just being able to help young people recognize their beliefs and their thoughts that's gets in the way of their greatness, right?
Right.
And so helping them with that. And so I am the owner of Unbreakable Minds Youth Life Coaching. And so that's what I do. And I help parents connect their children to their vision. And
Mm-hmm.
then we create a plan and help them achieve those goals. And then I also work with youth serving organizations to help them create safe spaces for young people to help them thrive as well. So super excited about that. But yeah, that is me.
Hey, hey. Since we're having this conversation about mental health, I know the term is thrown around and talked about, but let's really go into it and explain what mental health is and why it's important.
Right. So mental health is all about, um, it's a part of your overall health. You can't have overall health and wellness without mental health. People think, oh, if I just go to the doctor and get my physical health taken care of, then I'm good. But mental health affects how we think, how we feel, and how we act or behave, right? How we
Mhm.
show up in the world. It's important at every stage of life. So even as a baby, however, we can teach young people how to regulate their emotions and how to communicate and articulate what they're thinking and what they're feeling. Even as babies and toddlers and young kids is very important. On up to our later stages in life, right? At every stage in life, it is important, and especially during adolescence. That's when it gets real critical.
Mhm.
So it includes our emotional, our psychological, and our social well being, right? And it helps determine how we handle stress and how we relate to others and how we make choices. Mental health stirred up in the cup. That's all of that. So it's not just all about the mind, it's mind, our emotions, and our relationships, our social well being, how we show up in the world. All of that is mental health.
All right. And how do you feel it's important, not just for young people, but for adults as well, to practice mental health?
Absolutely. Because again, we were talking earlier about that cup, right? Filling that cup and keeping the cup full, keeping the cup overflowing. Because as adults, a lot of times, especially when you're in the human services field, you just feel like you're the one. You're the one that's there to do it, to fix, to help, to heal. Like, it's all on you. We wear a lot of hats, we carry a lot of weight on our shoulders. And if we're not taking care of ourselves, then we really cannot show up fully for the people that we serve. And so it's a lot of weight to carry. And so mental health is important for children because children will eventually be adults, right? And what happens
Mhm.
in that childhood is going to determine how they show up as adults. And then adults used to be children, so it's a continuum. It's not separate. It's different stages of life, but there's different levels of how you introduce mental health at those different stages. But it's
Mhm.
important that it's a part of that growth process and
Mhm.
that we are intentional about including that piece.
Mhm. And for this, as far as the adults are concerned, like what would be a suggestion for us to practice mental health? Because, like you said, working in the field of human service, you feel like you're the end all be all. You go hard, you're dedicated to what you do. Because if you wasn't, you would not have gone into this field.
Right,
I
right.
think that's fair to say. But
Mhm.
even in doing the work, you begin to, I feel like, get consumed with it that you forget to take care of yourself.
Mhm.
So how do
Mhm.
you begin to have that internal dialogue of, okay, I need to make me a priority?
Right. So number one, just making a decision. Again, talking about self worth and understanding that you are worthy of love and respect and care for yourself, right? And then once you recognize that you have an awareness, right? That you're intentional about being aware. And so your body is constantly communicating with you when it's not well or when it's
Mhm,
on the way to being not well.
mhm,
And so having that awareness helps you recognize when my mood and my mindset and my emotional well being is going in the wrong direction. And so when I have that awareness and I'm taking time to sit still to recognize and acknowledge what my body is communicating with me, then I can tend to it. We are human beings, not human doings. Right? And so we're supposed to take that time to be, but we spend a lot of time doing. And when we spend a lot of time doing and we're on autopilot and we're constantly moving around, we're not taking that time to listen to our bodies and hear what it's trying to communicate to us.
mhm,
And so I think as adults, carving out that time to be still, or even when I'm not still, when my body is giving me cues that I say, something is happening. So let me sit for a moment and figure out what it is. If I feel my heart start to race, or I feel that my mind is racing and my mind is spiraling, and I'm recognizing the change in my mood as my thoughts change, right? Because what I know is that my thoughts determine my feelings, and my
mhm,
feelings determine how I behave. So just having a keen awareness of how your thinking is impacting your life.
Yep.
And so, again, that's why I felt like it was so important when working with young people to really focus on the mindset. Because if I could recognize that failure is a part of the learning process, if I could recognize that when things happen to me, I have more control than I think, and
Hmm.
if I could just adjust my mindset a little bit, then I can adjust my emotions and I can show up better in the world with a lot less stress and a lot more peace. Yeah, yeah. So definitely when it comes to adults, especially in this field, when we teach other people things, we get to learn it again every time.
Mm.
So every time I teach mindfulness to my kids, I'm reminding myself of the importance of mindfulness, and I'm giving them new ideas, and I'm like, "Oh, that's something new I could put in my toolkit," right?
Right.
And so I just love the fact that it's mutually beneficial when you're working in this field if you're intentional and you have that awareness. Because as you serve other people, you're serving yourself. Sometimes I go in and I say, "Y'all, let's take a mindful moment," and it's more for me than it is for them.
Ha! That's right. Ooh, I need a minute,
It's
y'all. I need a minute.
you know, or the other adults in the room. I'm looking around, I'm taking a pulse check, and I'm like, listen, we need to calm this thing down. So let's do a mindful moment. Everybody's like, oh, okay. And they don't even recognize that I'm getting the pulse of the room and I'm recognizing that it's necessary.
Right.
So yeah. And so emotion regulation, self-regulation, like understanding your mental health really helps you with that. And
Mhm.
it's a good thing for everybody.
Now, when it comes to you establishing your mental health and you building your mental health for you, how do you begin to communicate your needs to the supervisor or the professionals that you work with that this is really important, not just to you, but also how can organizations help their staff in this area?
Right. So, I think that it's important to, number one, to foster a healthy relationship with your colleagues and with your supervisors. So you can be able to have those conversations. Unfortunately, we can control ourselves, but we can't control how others show up. And I may be saying all these amazing things that should happen at work, but I have to respond, right? Not react, but respond to the environment that they create. But I think it's important that we speak up about mental health in general, about our own mental health, and about um, safe spaces and the environment that we work in and that is conducive to us being well and being able to be in a place to serve the young people that we or the people that we serve. So I've done some presentations for college students and I'm telling them, you're going to walk into a boardroom, a staff room, a meeting, or whatever, and it may not be trauma informed environment, right? And so it may be up to you to introduce this concept and this idea to your superiors and the people that you work with. When I came to mental health prevention, I heard a lot of coordinators talking about how their young people, they were basically saying that they didn't know how to regulate, right? Self regulate,
Mhm.
right? And so I'm sitting and I'm listening and I'm recognizing it in my program as well. And so finally I said, has anybody ever talked about or used mindfulness? And so I introduced it to the team and I let them know I had done my research and I had been doing it for years. And so I was able to introduce them to something that they knew about but hadn't maybe thought about.
Mm.
Or I'm not sure, some were practicing it on their own, some hadn't practiced it yet. And so to be able to offer that as something for the staff as well as the kids, I could have been quiet about it and I could have
Mhm.
just said, I have an idea, but I don't know how they're going to receive this. But I offered it up and everybody was receptive. Another thing that I suggested is when we have staff meetings, that we do a wellness check, especially in this virtual world. We're not connecting with each other. We're not seeing each other in the office. We're not working together in person. And so those conversations we would have had about, girl, let me tell you about my weekend, or let me tell you what happened, on Sunday, or whatever the case may be. When we have our meetings, instead of going right into the meeting, let have a wellness check. So we kind of take a pulse of the room and we know where everybody is. So that's been something that has been very helpful. Going back to organizations, I think organizations need to make sure that during the onboarding process that they're having the conversation about mental health and wellness, and that they are offering up ideas and activities of things that they do that can create a safe space for their employees and just be able to open the conversation to let them know that we recognize that this is something that's important. I started hearing recently about mental health days and wellness days. Like a lot of organizations are giving you, in addition to your vacation days and your sick days, you get a mental health day. I'll tell you, early in my career, I was scared to death to call out of work, even when I had a
Weren't we
good reason.
all?
Listen, as a young professional, I was like, oh my gosh, what are they going to say? Can they deny my request? And some days I don't have an appointment. I don't have anywhere to be. I just need a day.
Right,
And then you're trying to come up with a lie. You're trying to come up with a good story about why I need a day off, and you hoping that you don't speak anything into existence that you told your bosses was happening, right?
right.
And so now to be able to say, I just need a mental health day. Put it in whatever category you want to put it in, but I need a mental health day. So to be at a point where you can speak up for yourself and be able to ask for those days, but for the organization to be open to say, okay, some other things is employee engagement activities and appreciation events. Again, having mindful meetings. So doing some of these strategies, we might have to have a movement break or a mindful moment in our meeting, right? Things are getting kind of hot and heavy. We've been grinding for an hour. Let's stop and have one of those breaks, right? Yeah, and so just to create community within the organization and have time for people to just get to know each other on a different level, and that it's not always work, 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 but on the clock, we're able to do some things that help create that safe environment at work and healthy environment at work. So I think that's all very important to any organization.
And that is very, very true. Creating those spaces for you, but also creating space as supervisors to have your staff feel safe enough to have those conversations for you. That like we're always grinding it out, we're always pushing forward. Um, but there are times that you are mentally and emotionally exhausted with the work that you do. And like the only
Absolutely.
way that you can replenish yourself is just to step back from the situation, step back from work, and work on what you need to work on mentally and emotionally for that day or for that time being.
Absolutely. And everything we just talked about puts us all at risk of burnout,
Mm,
right? And burnout has its own implications,
mhm,
especially if we're not paying attention and having that awareness and paying attention to our body, right? And so when you are not doing things to avoid burnout with your staff, then you're going to
mhm,
have a whole staff full of people who are burned out and they're nowhere near 100% capacity
mhm.
to be able to do the job,
Right.
right? So when we talk about prevention, we talk about getting ahead of all of those types of things and really preventing people from burning out to the point
Mhm,
where they're mentally, emotionally exhausted and they're not able to do the job. You'll spend more money on trying to create the wellness that you created in the job when you created the stress in the job, now trying to create wellness. You'll spend more money on that if you're not preventative and doing things within the organization to prevent that burnout with your employees. So,
right. Right.
absolutely.
And the one thing that struck me, one thing that I learned about when I went to a conference was building a emergency plan. And this is something that as supervisors we should do with our staff, explored and actually shared with other staff members, with other
Mhm.
supervisors in the organization. And they've used it for their kids that were just high emotions, building a self-care emergency plan for the child whenever they feel a specific type of emotion or they're in a specific type of mind mental. What do
Right.
you do in those emergencies? What do you do in those times for that specific individual? Kind of like when you're facing burnout, like, okay, when I reach here and I'm
Yes.
at this point, I need this.
Yes. And
Uh,
we already have a plan in place. So that's prevention.
right, right.
That
So
is prevention.
can you talk to us about making those plans?
Absolutely. Absolutely. So I just think that, there's a lot of organizations that don't have them at all. So at the organization level, from the top down, I think it's something that needs to be implemented first of
Mhm,
all, and then to have those as a team and as individuals to sit down. We sit down and we do appraisals every year, right? We sit down and we talk about what are our goals, how can we do more work, how can we work harder, how about let's incorporate in those appraisal times, um, what is the plan in the event that something, some mental or emotional setback or something is taking place? What do we do? And to be able to individualize those plans. So we don't want to have a plan that says this is what everybody does, because this doesn't work for everybody. This particular
Mhm.
plan may not work for everyone. But maybe we have a general plan that everybody can start with as a team or as a group or as an organization. But when we have those appraisals or those conversations, this is my situation. This is what I have going on at home. These are my health challenges that I may have. So this is a plan that works out for me. So I honestly think having that conversation and an individual plan, and so everybody knows what to do. As far as for our children, again, we sit and we have meetings for IEPs and 504s and things like that. And so we need to incorporate a plan for my emotional wellness, or how do I regulate, or how do I co-regulate with a young person when they're in crisis or approaching crisis. And then to talk to that individual, have that individual in the room so
Mhm.
they can say what they need, right? No matter how young, they can tell you, when I'm feeling this is what happens. So have them at the table. I always say, if you're not at the table, then you're on the menu. And you don't want people talking about you when you're not there, even if you're 7. Right? So if I'm creating this wellness plan or this emergency plan, then have that person, at that young person, even if it's, a really young person, have them at the table so that they can contribute to it. And then it's an accountability thing. If I help create this plan, then I need to do my part to make it work, right? So I said I was going to be able to do this. Okay, so now's the time. We're going into action mode. This is my part. Now you do your part. And let's see if we can, get to a good place, and then we can talk about it, and be able to figure out what you need and get those needs met.
Right. What are some things when building that plan? What are some things that's important to
Have
So you definitely want to identify a person that the person connects with.
Mhm.
So whether you're a child or an adult, who is a person that, if I am in crisis mode, who in this space is a person that I want close to me,
Mhm.
right? I may not be able to articulate that when I'm in that crisis mode. I may not be able to say, go get so and so.
Mhm.
So in my plan, I need to figure out who that person is and make sure that everybody knows who that person is for me. And then maybe who to call, things like that. And then what is the best space that I want to be in? So
Mhm.
if I'm in that crisis mode, where do I want you to take me or escort me that is a calm place for me,
Mhm.
where I feel like I can calm down and get myself together? So
Right.
definitely determining that in advance. And again, just being able to walk through how I handle situations and what strategies work best for me.
Mhm.
As I'm teaching kids strategies, I'm using strategies within my organization. Out of these strategies that I'm using, whether it be some kind of mindfulness exercise that we did, some breathing exercise that we did, which one of those things worked for me that you could help walk me through
Mhm.
during that time, right? There are a lot of grounding activities that can be done. And grounding activities are just to bring me back to center, something that takes my mind totally offloads like the apps on your phone, just offloads all of that. And it brings me back to the present moment, right? And so, what grounding activities can we use that's going to help you stop thinking about what's going on and get you to a place where you're grounded and you're present and you're in the moment? And then we can decide what happens next. Because a clear mind knows what to do next.
Yeah.
And so, if I can ground myself and clear my mind, then I can get into my upper brain, right? My prefrontal cortex, and get out of my survival brain
Right. Right.
and,
Right.
and be more clear and make some better decisions and calm my nervous system down so that I can come to a solution that's going to work for me and everybody in my space.
Right. Awesome. So thank you for sharing that, Miss Yolanda. That is very, very insightful, and things like I never would have thought to not think of strategy, not say think of strategy, but also have a person that you could identify with, that's like, I need, when I'm feeling this way, like I need this person.
Right. Right.
Or
I was
I
talking
need this item, because it's more of a textural thing, like getting like little softball, teddy
That's good.
bear, things
Mhm.
like that. Because I might not be able to
Mhm.
get it individual, but if I have this specific item, and
Right.
based on how it feels and how it makes me feel, I
Right.
could begin to calm down.
Right. And you bring up a good point because, we communicate with the world through our senses, right? And so when we're triggered and when our stress response is activated, it's because something came in through one of our five senses.
Hmm.
And it's activated our stress response within our nervous system. So if we want to bring ourselves to a calm place, guess what we got to do? We got to tap into those five senses.
Hmm.
And so when you talk about touch is one of those five senses. And so that may be what does it for me.
Hmm.
Having something that I can feel that is going to calm my nervous system. Or music, something that I
Hmm.
hear, right? Somebody, that person's voice, some type of music that I hear, some calming sound, something that I can see. Like I said, when we move to a different space and my environment is different, and what I'm looking at is different, that may be something that can calm me down as well. It may be water, it may be something that I can eat or taste that will help calm me down. So remembering our five senses when we are trying to deactivate our stress response and activate our relaxation response. Thank you for that. That was a good point.
Thank you, Miss Yolanda, for providing that wonderful information. This will be a good point for us to transition into our professionals lounge.
Professionals Lounge is a segment of the show that allows guests to share advice and tips with other practitioners in the OST and youth development field about how they can begin growing their gifts and talents, but also developing themselves as professionals in the field.
So, Miss Yolanda, for Professionals Lounge, my question for you is what boundaries would an individual set for their job when practicing mental health?
I'm so happy you asked that question because boundaries are so, so important. And I always say that the only people who get upset about you creating boundaries are the people who benefited from you having them in the first place, right? So nobody should be mad when you are creating these boundaries. Let's just start there. But some suggestions I have is number one, recognizing that you have a voice and use your voice. If you are at your job and you're realizing that the leadership is not acknowledging something that is causing the environment to be stressful or toxic, um, if you don't say something, not only does that prevent you from getting what you need, but also other people in the room who may not be comfortable expressing or acknowledging what's going on. So definitely recognizing you have a voice and using your voice. And then when you come sharing that there is a problem, issue, or concern, that you come with some solutions, right? Because people are more receptive when you come with solutions, because then it's the shared responsibility.
Hmm.
I'm in this space as well, so I'm not just coming complaining to you, but I am coming with solutions. And then again, that's you inserting your voice and being a part of the solution and not the problem. Remember to work within your work hours. Oh my gosh, how many on email at 8, 9 o'clock at night? Okay, can we raise a hand, everybody? Right. We can't see you. Go ahead and raise your hand. So working within your work hours. And even if that means you might have taken 30 minutes for your wellness during the day, okay, you could work till 5:30 instead of 5 to make that up. But other than that, stick within your work hours and know how to turn it off. Turn off the notifications on your phone from your job. A lot of us have our work email on our phones. And, I don't know about anybody else, but the iPhone users, like, you can set up all these different kinds of do not disturb. You have focus, you have personal do not disturb, and you can set it up to say, don't tell me this. Right? I don't want notifications from these people during these hours. So, just turn off the notifications. Don't feel like you need to respond when you're off work, whether you're on vacation or whether it's the evening. It can wait till tomorrow. It really can. It can wait till tomorrow. And then find creative ways to decline invitations to do things when you already have too much to do. If there's a choice, find creative ways to decline or say no, right? Because you want to prevent being overextended and overwhelmed. And that's how you do that sometimes. There are so many nice ways that you can say it. It's not a good time for me, or I can't take that on right now, or I'm protecting my mental health And I am at my limits, and so I'd be happy to maybe help you next time, or don't be afraid to come back and ask me again. But for today, it's a no, and be okay with that. And then taking those mental health days. Again, if you need the time, then take the time, because you're no good to anyone if you show up and you are approaching crisis mode, right? You want to stay home and take care of yourself. And if it's nothing that the pandemic has showed us, they're really quick to say, if you're coughing or you're sneezing or you're not feeling well, stay home. Like, you don't have to ask any questions. You could just call in, it won't be a problem. Well, it should be the same for my mental health. If I'm feeling overwhelmed, overextended, and I need to do something to fill my cup to get it overflowing again, then I need to be able to take that day to do that, or take that time to do that.
Well, thank you, Miss Yolanda, for being on the show and talking to us about mental health that we are now being very, very serious about. And it's about time. It is about.
Absolutely.
Oh, Miss Yolanda, you got anything you want to plug in? That's what I forgot.
As always, Unbreakable Minds Youth Life Coaching is here to work with youth ages 15 to 25 and their parents to help them to remove negative thinking, whatever's in the way of their greatness. We do individual coaching as well as small group coaching, as well as training for young people and the adults who serve them. And now we're putting more of a focus on parents and helping parents help their children be prepared to leave the nest.
Amen.
So, yes. So, if you need any assistance with any of that, you can reach out to us. We're on Instagram and Facebook at Unbreakable Minds Coaching. I am on LinkedIn at Yolanda W. Hall, and even on TikTok at Unbreakable Teens. And so our information is all there, and don't hesitate to reach out to us. And we have possibility calls and strategy sessions that don't cost a thing. So if you could reach out to us, then we can help you step into your greatness, or create a plan to get there.
Yeah. All right, y'all.
Well, everyone, that brings us to the end of our show. I'd like to thank our wonderful guest, Miss Yolanda, for being here and giving us that great information. As always, whenever you are ready to come back, Miss Yolanda, you are welcome. Keep dropping those jewels for us. If you enjoyed this episode and feel you received some good information, give us a review on Apple Podcasts or visit the Podchasers website and leave us a comment. This will help us get some feedback on the show and collect testimonials for our personal website. Share us with your friends, share us with your family, share us with your network. Help us spread the word about how OST programming is impacting our youth as well as our communities. We can be found on Apple Podcasts, Spotify, Google Podcasts, and Podcast Addict. Well, that's all I have for today. In the words of Mr. Arthur Ashe, start where you are, use what you have, do what you can. Until next time, bye-bye.